Hello, my name is Donna Hamilton. Today I'll be delivering a community health analysis on the city of Brooksville, Florida. Brooksville officially became a city within Hernando County, Florida in 1856 and became incorporated in 1880. In just over 130 years, the city of Brooksville has gone from an isolated agricultural township of just over 600 residents to a multi-ethnic population of over 8,000 people with an abundance of hunting and fishing opportunities for residents and tourists. The overall structure of Brooksville meets the needs of the citizens. The parks, streets, sidewalks, parking lots, and streetlights are all in sufficient repair. There are a few areas in Brooksville that is in need of home repair and trash on the ground. Code enforcement department is actively addressing these issues. Fortunately, the city's code enforcement agency handles code enforcement complaints, requests, as well as links its citizens with services and assisting with remedying code violations. Brooksville and the surrounding areas suffer from high rates of non-communicable diseases, tobacco usage, and poverty. The median income is just over $32,000. Roughly 18% of the population lives below the poverty threshold. All of these issues the World Health Organization states are global health problems. The World Health Organization, along with its member states, are campaigning for the Sustainable Development Goal of good health and well-being. The non-communicable diseases such as cardiovascular disease, cancer, chronic respiratory disease, and diabetes are all concerns for this community. One of the major risk factors is a low socioeconomic status, to which Brooksville falls within that. Brooksville has a higher than average violent and poverty crime rate, more than the U.S. national average. The tobacco and alcohol usage are 20% higher than national average, which in turn drives up the non-communicable morbidity and mortality rate. Alcohol and tobacco use are at the forefront of the Sustainable Development Goals and are directly linked to the Sustainable Development Goal number 3 of good health and well-being. This goal is tasked with reducing non-communicable disease premature mortality rates by 1/3 as of the year 2030. Brooksville, like many places, has issues regarding access to healthcare. There are healthcare facilities available to the residents. However, there's a struggle with approachability of the healthcare professional, acceptability of services in relation to the perception of the patient, and the biggest issue of all, affordability. Roughly 19% of adults and 7% of children living in Hernando County are uninsured, with a ratio of 1 in 1,880 primary care providers to residents. The average healthcare cost per person reaches over $11,000. The Healthy People 2020 campaign believe in the objectives of increasing the number of people with health insurance, increasing the number of people who have a regular primary care physician, and reducing the amount of people who delay in seeking medical care, all of which help reduce the above health disparities in Hernando County. Brooksville does not currently have a discernible environmental issue. The air and water quality are publicly reported, and in fact, Brooksville has some of the best water in Florida. The air quality is noted as good. The sewage is collected and processed with little to no effect on air quality. Vector control is top-notch, and if a citizen notes the need for additional vector control, they can alert the city. Reclaimed water is at the forefront of the environmental issues in Hernando County. The Reclaimed Water Master Plan, in partnership with the Southwest Florida Management District, is looking to send the reclaimed water back through the aquifer to be naturally filtered and used again. The government of Brooksville is incredibly accessible, and the City Council meeting dates and times are posted online so that citizens can attend and make their needs known. Economically, Brooksville is not doing that well. Many residents live at or below the poverty threshold. Property values are lower than average. However, with new community development plans, the city government is hopeful to breathe new life and money into Brooksville. The city of Brooksville suffers from limited access to health care, substance abuse problems, poverty, high crime rates, low education levels, and lack of ethnic diversity. The residents of Brooksville are either underinsured or not insured at all. Due to this fact, they have limited access to health care, with the exception of hospital visits. Ongoing health disparities related to income are a problem within this community. Brooksville has higher than average substance abuse issues related to tobacco, alcohol, and drug abuse. The World Health Organization's Sustainable Development Goals center around health and wellness, and the reduction of premature deaths related to non-communicable diseases. With some of these risk factors surrounding substance abuse, tobacco use, alcohol, and drugs. Many of Brooksville's residents live at or below the poverty threshold. There are many health disparities related to low socioeconomic statuses, including increased morbidity and mortality related to non-communicable diseases, increased infant mortality rates, HIV and AIDS, and obesity. In 2004, the Office of Minority Health was created to further the efforts to educate healthcare providers of health disparities. Violent and poverty-related crimes are higher than national averages. This is likely due to the number of people living on little to no income. Crime is also believed to be a public health issue. The level of education directly reflects how much money a person earns. In fact, a college graduate earns more than 2 times the amount of a high school dropout. The more money a person earns, the more likely the person is to have access to health care, healthy foods, and physical activities. Reversely, a person in a low socioeconomic bracket has a greater risk of going hungry, addiction issues, poor health outcomes, and experiences more instances of depression. The City Council is comprised of all Caucasian women and men, and the population of Brooksville is about 72% Caucasian. With racial disparities within the healthcare industry, it would be beneficial for the government of Brooksville to be racially diverse. The Affordable Healthcare Act of 2010 seeks to diversify the healthcare professional population to better meet the needs of the diverse patient population. We should also have this among our government. Brooksville, like most communities, have come a long way in relation to diversity, finances, and health. The government, along with the residents, ensure that the communities have clean drinking water, unpolluted air, and educational institutions. Access to health care, substance abuse, poverty, and crime still plague Brooksville. They, however, are moving in the right direction, and with continued education related to health disparities, they are hopeful to rectify these issues.